Hi everyone, this is Neel Raithatha, consultant audiologist and director of earwax. Thank you for joining me in my latest video. So here we have a patient who attended with a fungal ear infection, so otomycosis, and she had been symptomatic for several years actually. So her main symptom was itchiness and irritation, and she just lived with it, if truth be told. She occasionally used a Q-tip to scratch the inside of her ears, but it was never severe enough for her to seek treatment or visit their doctor or an audiologist. And progressively, this has got worse. And more recently, her entire ear canal became blocked and it became a bit painful. Now, just at the entrance, you may have noticed there's a bit of a furuncle there, just there at the top. May also be some granulation tissue, but what was interesting with this case is that once I removed this debris, and we know it's a fungal infection because you'll see some spores in a moment on the eardrum itself, but she had an underlying perforation, so a hole in the eardrum, and we don't know the exact cause, but it could be that she's got what we call a mycotic thrombosis of the eardrums, so basically a blood clot caused by the fungus, which has then deprived the eardrum of the necessary blood supply, which has then caused it to perforate. You'll see it posteriorly, you'll see it about 3 o'clock. So when you've got a perforation, there's many different reasons, and it may have been a middle ear infection, so there was catarrh, discharge in the middle ear, which filled up, and eventually when the middle ear is filled with fluid, infection, eventually it can no longer contain all that infection or discharge in the middle ear, so it ruptures through the eardrum. But the area around the perforation seemed quite dry actually, so I suspect this is more likely due to a secondary perforation as a result of otomycosis, so an outer ear infection due to fungus. Now, of course, we referred this patient to their GP and then to ENT, and it was a bit tricky to remove because she was slightly nervous. There's a bit of pain in the ear. Normally fungal infections, the main symptoms are itchiness and irritation and loads of dead skin. It's not always painful, but of course she's got this perforation in there. There is some fungus inferiorly on the eardrum that I found difficult to remove. I was able to gain access, but it just wasn't coming away. It was kind of embedded onto the eardrum, so there's still a bit of residual fungus there, but I just wasn't able to remove it all. So this patient will need treatment from ENT. Now, most antifungal treatments, topical agents, are not really known to be ototoxic. So I know of cases where patients have got fungal ear infections and a perforation, and they are prescribed topical antifungal solution. But I was just doing some more reading about this, and one of the methods that have previously been used, and this is not only relating to a fungal infection, it could be a bacterial infection if there's a hole in the eardrum. So ENT sometimes would temporarily close that hole. And one of the things that they previously have used was cigarette paper. Now, I'm assuming that's the Rizzler paper, and they'll sterilize it. They will cut it in the shape of the perforation. And what they will initially do is, under a microscope, just kind of make a clean incision around that perforation, which promotes healing of it. When you've got a hole in the eardrum, what can happen, the outer epidermis layer of skin that forms the eardrum, which has got 3 layers, it kind of migrates inwards into the perforation, so it's very difficult for it to then close. So if you make a fresh incision, you can see around the edge of that perforation, it's protruding outwards, and that looks like the skin is kind of on the eardrum as it's migrating, it's curling over that hole and then going inwards, and it's created this little ridge around the periphery of the hole. So yeah, I've known of cases where they just cut around that ridge, so in essence you're going to make the hole a bit bigger potentially, and then temporarily place some cigarette paper, obviously it's sterilised, over that hole, and that closes the hole, so you can use topical antibiotics, or in this case topical antifungal, and it then gives the chance for that hole to completely heal. So it's the best we could do. I couldn't do any more as it was getting painful for the patient, but yeah, that perforation wasn't visible. So if you do suffer from itchiness in your ears, it's not something that I want you to ignore. Please visit your doctor or your audiologist, because you may have an underlying fungal ear infection. Take care, guys. Keep well and speak soon. Bye.